Have you been thinking on what to do in order to get pregnant with twins, triplets, or quadruplets? This video is for you today. So today we're going to be talking about the various factors which increases a woman's chance of having twins, triplets, or quadruplets. There are genetic factors and there are other medical methods which can be used in order to increase a woman's chance of having twins, triplets, or quadruplets. So today, stay tuned and listen to the truth about all this. Welcome back to Talk Pregnancy with Dr. Noella, where we tell you all about pregnancy and other women-related health issues. So please, if you're new to this channel, please click the subscription button so that you can be able to get weekly advice on women's health and pregnancy-related issues. Those who have subscribed, thank you very much. I love you. So today we're going to be talking about the methods in which you can use in order to have twins, triplets, or quadruplets. How does it come about? So we'll start right from science to know how twins can come about and what are the different types of twins. There are two types of twins. We have the fraternal twins and the identical twins. The identical twins is the one which is rare. It is less common than the fraternal twin. Accounts for 3 to 4 births in 1,000 live births are identical twins. So how does it come about? In order to have identical twins, that means that one egg has been released during ovulation. We know during the menstrual cycle, there's ovulation where you can get pregnant. So once ovulation occurs and the sperm fertilizes one egg, this fertilized egg, that's what we call the zygote, decides to divide on its own and forms two. So that is what we call identical twins. So in this kind of case, we say they look alike, they look each other. So it's just one egg which was fertilized by one sperm and they tend to divide. Then in fraternal twins, that's what we call non-identical twins. What happens is that the woman tends to ovulate two eggs at the same time. What do I mean by that? During ovulation, just one egg is being released from the ovaries. But in some women, they can tend to ovulate 2 eggs or even 3 at once. So once these eggs are being released and they are ready for fertilization, we know millions of sperms are present when in one ejaculation. So you can have a lot of sperms present. So if these eggs are being fertilized by these different sperms, we have different children. So in this case, they don't even resemble. And in identical twins, we have just one sex. You cannot have a boy and a girl in identical twins because it is just one zygote which decides to divide on its own. But in fraternal twins, you can have either a male or a female, or you can have them of both genders. So in this kind of case, you have different placentas. So it is actually just something like a brother and sister or sisters. So for identical twins, it does not have really a genetic link, even though there's some families where they tend to have a lot of identical twins and sometimes it's seen like they have a genetic link, but there is no scientific backup for that. And also another fact which can increase the chance of you having an identical twins is in vitro fertilization, and the number of days where the zygote lives out and before it is transferred into the woman can increase the chance of you having an identical twins. So if it stays for a longer time, there's a higher chance of the zygote dividing before they insert into the mother. So the factors that increase the chance of a woman having twins naturally, especially the fraternal twins, there are natural methods and there are other methods. For the natural method, the first factor that increases a woman's chance of having twins is if she has a family history of twins, especially if it is from the mother's side. She has a higher chance of having twins than her counterparts who don't have twins in their family. And if it's the father's side, it is more common in their children. If they have girl children, these children might have a higher chance of having twins. And also, if the woman herself is twins, she has a higher chance of having twins than others. We also talk of age. Age is a factor. It was proven that women who are above 35 years of age and getting to their early 40s, they are at higher chance of having twins. Why? Because as you get older, the level of the follicle stimulating hormone increases as you get older, because the follicle stimulating hormones, they help in the maturation of eggs. So once it's increased, there's a higher chance of you ovulating more than one egg at once. Women who are tall, who are overweight, also have an increased chance of having twins than their counterparts. And this is because with people who are overweight, there's an increased level of estrogen, and estrogen too is the hormone which helps in the maturation of eggs. So once these hormones too are increased, a woman's chance of ovulating 2 eggs at once also increases. Another factor that increases a woman's chance of having twins is breastfeeding. Normally, it is said that when breastfeeding, it's a natural method of contraception, especially during the first 6 months of pregnancy, and this woman is practicing exclusive breastfeeding. But if she tends to get pregnant while she is breastfeeding, there's an 11.4% chance of her having twins than a woman who is not breastfeeding. Other factors which can increase a woman's chance of having twins is if she is placed on fertility medications. These medications should be prescribed by a doctor. This is if she's placed on these fertility medications like clomiphene citrate. These are medications which are used to increase a woman's chance of ovulating more than one egg during ovulation. So in women, they put them on these medications to increase their chance of them getting pregnant. So we have medications like clomiphene citrate and letrozole. Women who are placed on these medications have a 5 to 12% increased chance of this woman having twins. And in other fertility medications like the gonadotropins, which are injectable fertility medications, once this is taken, it increases the chance of a woman having twins at 30%. These ones even increase the chance of this woman having even triplets and quadruplets. So the method which has the highest probability of you having twins is the in vitro fertilization, where more than 1 or 2 zygotes, that's the fertilized eggs, are being introduced into the woman. Procedure where the egg and the sperms are being fertilized out of the woman, and they are going to introduce 2, 3 or 4 of this fertilized egg into the woman to increase the chance of her having at least one of the babies surviving. So if 2 or all of the zygotes which have been introduced, they tend to implant and grow. This one increases the chance of you having twins by 60%. So this is the highest method of which you increase your chance of you having twins. There are some myths about having twins, which the first one is diet. It's the conception that people who eat a lot of dairy products like milk, yogurt, they have an increased chance of having twins, but this is not scientifically proven. Also, yams. Yes, yams, most of the times Calabar yams. And why do they talk about this? Is because Nigeria is the country that has the highest number of twins. So the highest number of yams in the whole world is being produced in Nigeria. People believe that if you eat a lot of yams, you're going to give birth to twins. But this is not scientifically proven. But if you want to eat the yam, you can eat, and yams, it does not cause harm to anyone, like when we talk about the drugs. So you can eat yams, enough of it, but it is not scientifically proven. The other people believe that taking metformin increases your chance of you having twins. But these are medications which are used to decrease your sugar level in people who have diabetes mellitus, but it has not been proven to increase your chance of having twins. Also, folic acid. Folic acid is a normal medication which are given to women who wish to conceive and also throughout your pregnancy. So it is not really a medication which is used to increase your chance of you having twins. So now, if you have twins, how can you know you have twins? What are the signs and symptoms you can know you have twins? You have missed your period, you do the pregnancy test. How will you know that these children you're carrying are twins? The first thing is you have excessive vomiting. This is what we call hyperemesis gravidarum. It does not rule out the fact that even with a normal pregnancy you can have this excessive vomiting, but it is very common in women who have twins. You have your abdomen bigger than your gestational age. For example, if you're saying you're 3 months pregnant and you start seeing your abdomen already protruding out, you can start thinking that you have a twin pregnancy. So once you have a twin pregnancy, it is good you do a follow-up. The number of times you attend your clinic is going to increase because this is a high-risk pregnancy which needs a lot of care. So if this was helpful, please click the like button, and also if you want us to discuss anything, you should drop it on the comment section. And if you want to have a private chat with me, you can follow the link or the number. Contact me for any problem women related and we're going to get to you. Thank you very much.